I'll give you a little framework of what we just discussed this morning. We can clearly talk about all activities that the U.S. Army are taking in support of the Commander-in-Chief's guidance for the fight against the COVID-19. So this morning, General McConville, the SMA, and I sat down with MRDC leadership and went through the 3 lines of operation of prevention, detection, and treatment that the Medical Research and Development Command is organized against this extraordinary challenge. And so we talked a little bit about the infusion of funding that's come from the second and then the supplemental that was just passed the other night, but also the request for just shy of $900 million to finance those activities across those 3 lines of effort. How the team has postured itself to expand its capacity to attack those lines of effort. There's about 5 tracks of vaccine efforts with a couple dozen candidates that are being worked between the private sector and the government, and they talked us through how they're looking at these various candidates and ultimately will select the best horse to back and get through the process. As well as on the prevention side, we looked at the diagnostic kit capacity and how they're working with industry to increase capacity of testing from both a mobile site to as well as some much more larger scale national-like capabilities. And as well as on the treatment front. They actually walked us through how the soldier in Korea, who was one of the first soldiers infected by this terrible virus, and how he is, as treatment has been going. Very fortunately for us, an officer who was stationed here is one of his attending physicians forward, so they have great relationships and passing of the information. I'll tell you, it's extraordinary the pressure that is under that soldier's family, and he's donating his blood, and he is doing everything he can to be supportive in this process. So, God bless him and his family as he gets through this fight. We got to spend a few hours with some extraordinary Americans who were at the forefront of this fight, and we're getting them all the resources that they can, trying to get them as much time and energy as they can so to knock down any roadblocks that are in their path of moving samples, getting through bureaucratic hurdles. So putting the entire weight of the Army behind this effort. I'd like the Chief to make a couple comments, and then maybe we can open up for questions.
The heroes in this fight are going to be some of the people we saw today, the scientists that are working to find the vaccinations, the scientists that are working to find the drugs for treatment, the scientists that are aggressively increasing the capacity of the testing capability, and then all those medical professionals, those doctors, those nurses that are throughout the country that are really going to defeat this virus. But we are here to assist them, and we are very proud of what they are doing.
I'd like to ask you if you see that expanding other programs, that decision, and if so, at what point does the suspension of troop movements affect readiness, and do you potentially see a shortage of resources in CONUS as U.S. troops are able to come back from overseas?
Yeah, I think what we're seeing is commanders are doing risk assessments in each of their theaters. They're making sure that they have the appropriate force available to conduct the mission. That's what General Miller is doing. He's assessing the situation over the next 30 days, and he'll basically do an assessment of risk to the mission, which he's trying to accomplish, and risk to the force, and we'll work that very closely with him.
And at what point do you see it potentially affecting readiness overall? Could it extend to the other programs potentially?
Well, I think what you're going to see is, over the next 30 to 60 days, we're watching this very, very closely, and then providing the resources for screening and testing so we get an assessment of what the risk to the force is, and then from that we can determine what the risk to the mission is. And so we don't know yet exactly how that's going to play out, but we do have the procedures and measures in place to conduct the missions and at the same time protect the force.
On conditions, including that you said we're needed for DAC at full capacity, is there any update on the release of that money?
over the last, I guess it was 8 or 9 months, there was work that had been going on back and forth between the MRDC and the Office of the Secretary of Defense. The business model for this organization is a reimbursable model, and so eight other government agencies would then come here and apply, put work orders in, and they would conduct the research. What you're reflecting is the funding associated with that. There was some back and forth just about the operating model of how things would work, and I'll refer to General Talley and any other specifics I may miss. But that was a part and parcel of just how it operates. The MRDC has been moving towards a rate board so that they could much more clearly articulate the costs of how the work gets done, and that going forward will operate under that different model. With respect to resources, though, over the last, I would say 30 days, General Talley, correct me if I'm wrong, we've been moving millions and millions of dollars. There's a $900 million request that's in the third supplemental, so there's an infusion of financial resources that are coming to MRDC. General Talley, anything you want to add?
Absolutely. And with respect to the COVID efforts, we have to think of that completely separate and different from our funding streams. And the Secretary of the Army, Chief of Staff of the Army, very good at just securing the dollars that are going to come in for that specific research. And with respect to RID, U.S. Army Medical Research Institute of Infectious Diseases, if you think of a twofold mission, which one is for research, the basic research that goes after the diseases, the non-battle injuries, if you will, that affect our soldiers, sailors, airmen, and Marines. And then there's a response mission, like what we're facing right now with COVID. If you go back to the Ebola crisis, even Zika, this laboratory has played an important role in the discoveries towards prevention, treatment, and detection. So completely different funding stream. We're working well right now with OSD for that the temporary funding withhold, again, getting the financial apparatus to where we can manage effectively. But with respect to COVID-19, no disruptions whatsoever, and we're expecting, in fact, we've actually received additional funding for that effort. Thanks for the question.
Are there additional resources that can be put towards this fight? Is the Army doing more?
It looks at a variety of different capabilities that can be brought forward, whether it's medical support, but it's also the research, like we're talking about here. We're learning every day around the country, and we're learning from in Korea and Italy. And one thing that I was remiss to say in my opening remarks is just the extraordinary performance of General Abe Abrams in Korea and Major General Roger Cloutier in Italy, of how they've been able to protect the force forward in some very tough environments. We've learned a lot from the tactics, techniques, and procedures, just how they prevented the outbreak and be able to protect the force in this difficult climate. I don't know if you're referring to doing more for around the country. We have combat support hospitals on prepared to deploy orders. The U.S. Navy is deploying their ships, the Comfort and the Mercy, which are hospital ships. We have additional capabilities that we're looking at, but a lot of it comes down to working with the state levels and knowing what their needs are, and then ultimately the Commander-in-Chief make a decision and push those capabilities forward.
How is it going to impact your recruiting goals for this year? What adjustments are you making, or will you be making, when it comes to the throughput of recruits into their units, or even into basic training itself?
I would say initially that I think the Chief should come in as well, but we were in very good shape with this recruiting cycle, actually ahead of goal, substantially ahead, so we have some margin at this point, but we're learning every day. Is this a flu virus that is seasonal? Will it boomerang back in this next cycle? Every day we know more, so when you hear the leaders like Dr. Fauci and Dr. Redfield talking about testing, and we're getting more data every day. We're getting smarter on this problem every day. The measures that we've taken, a lot of it is risk-based. There are areas of the country that are being affected more than others, Washington State, New York. And if you look at young men and women that feel like they need to stay home and be with their families, we're looking at options like delayed bonuses and others so that we can keep them in the queue, try to weather through this very difficult period, and then ship later. So I think Major General Frank Muth at Army Recruiting Command is doing a remarkable job. And he's 45 here, 50 there. He's got his finger on the pulse of this effort. We're looking at measures of how do you move troops through the MEPS process and ultimately to a recruiting location, but we got to be as safe as we can. We have got to be able to protect the force. The world is complex and dangerous on any given day. Now you add these additional conditions. We're literally managing this on a case-by-case basis in the department, and we're making very appropriate risk-based decisions. Chief?
Yeah, parents are sending us their sons and daughters. We have an obligation to take care of them. Many of these young men and women were expecting to go to work, so they may have quit their jobs to go ahead and serve, so we're very cognizant of that. As the Secretary said, if for some reason the situation does not allow them to ship, then we're looking at ways we can possibly compensate them so they're not unemployed and they make a commitment to us. But the second thing is we're putting in place is measures all along the way to protect these young men and women. So when they go to the recruiter, they'll, before they leave the recruiter, they'll be screened. When they go to the military entrance processing station, which we like to call MEPS, and I had to kind of remember what that meant because I thought you might ask me, but that's where they go. We're doing the same type of screening there. And then when they go to one of our 4 training sites, whether it's Fort Jackson, Fort Benning, Fort Leonard, or Fort Sill, is we want to, again, bring them in, test them, and then have the capability if someone shows some of the symptoms, we have the ability there to go ahead and quarantine them and make sure they have the necessary medical capability so their safety is secured all the way through the process. And what we're really trying to do with our bases, in a lot of ways, is what General Abrams found is the closer you can make it to a bubble, a safety bubble, where everyone is screened and we're not in a position to be affected by the coronavirus, the better off we'll be. But we are piloting that this week. We've kind of reduced the amount of recruits that we would normally send. We'll see how that plays out. We're going to adapt the process and come back with some recommendations.
So you're not recommending it, excuse me. So at this time, you're not recommending accepting recruits into the four basic training?
No, we are. We're shipping right now. We are.
No, you're not going to stop.
Right now, what we're doing is we're putting procedures to allow us to continue to ship, and that's going to be based on the rest of soldiers will continue to ship to basic training.
But literally getting down case by case. You were on this VTC with us yesterday. You would have seen Major General Frank Muth was drilling down into zip codes of just where these young men and women are coming from, making risk-based decisions, communicating with them based off of challenges they may face in their neighborhoods, and we're going to manage that accordingly and look to see if you can put in a delayed bonus or something of that nature to keep them in the queue, but should try to weather through this very, very difficult period.
Nancy, do you have follow-up?
I just want to follow up to Rachel's question, if I could. We'd heard yesterday that there's 1,000 beds available through, I think, the Army and the Air Force for military hospitals. Can you tell us what units have been called up, how many could be called up, and what capacity you could offer in terms of military sort of tent hospitals going forward?
There's 2 combat support hospitals that are on prepared to deploy orders. So that's a very short string, bags packed, getting ready to go. Now, each one of those hospitals, correct me if I'm wrong, Chief, is 264 beds in each of those 2 hospitals. And then they have ICU capability. 284. Excuse me. We'll get you the math.
We'll get you.
But that's 2 of these hospitals, 2 field hospitals. We have more capabilities, but obviously we have 191,000 troops deployed right now. So we have the baseline of capabilities, and we're working with the Office of the Secretary of Defense on the capabilities moving forward. But one thing that we really need to think about is this: the National Guard is on the front edge of this. Guard units supporting in their states. What I think they're referring to, the quote you're referring to, was General Friedrichs from the Joint Staff.
Yes.
He was talking about some active duty capabilities that we could bring very quickly to the most affected states at this point, Washington State and New York in particular, that they're on the short string to support that initially. Now, but I think it's very important to truly, in your reporting, to look and see just how much the National Guard is doing at this juncture. Chief, anything you want to add?
Yeah, I do want to talk about the National Guard. One of the decisions that you heard we made, the 81st Stryker Brigade Combat Team will not deploy to the Combat Training Center. And that's a fairly significant event because those soldiers are coming from Washington and California. So one of the ways we support the community, quite frankly, is saying, hey, we're not going to take those guardsmen and put them in a training environment because we're anticipating that they, when we talk to the states, they need to be used locally to help with logistics, to help with medical, and so those are some of the type of things we're doing. And many of, when you look at the Secretary talked about, we have different types of hospitals. We have what we call a combat support hospital that has 248 beds. We're in the process of, transitioning to field hospitals that have 32 beds, but they can be augmented. So we have different capabilities that we're putting on the active force. We're saying, okay, who's ready to go? Who's not ready to go? Get ready to go. But the other thing is we're doing risk mitigation because these doctors, these lawyers, these doctors, these nurses, these medical professionals, they also work in our medical treatment facilities. And on our reserve side, many of these medical professionals, they're actually working in the community. So if we take them and call them up in the reserves, we may be taking them out of the very communities that we're trying to help. So that's what we're going down to the person. Is this person, engaged in providing medical support in an area that they really need them? If we call them up, are we going to hurt the community? And we're getting down to that level on who we pick.
And as well as what the chief mentioned is changing the configuration of these hospitals from just pure trauma to working infectious diseases. They're in the process of that and be ready shortly.
And that's a point which I really want to reinforce the Secretary made. These hospitals are really designed for combat type operations, trauma, gunshot wounds, blasts, and those type things. They're not really designed for infectious diseases. But what the military can do is maybe take the load off and allow the civilian hospitals to focus on these issues. The other thing we're doing is our Corps of Engineers is working very closely with at least 4 governors we know right now. Our head of the engineers, General Todd Sumnight, met with the New York governor. And people talk about can we build hospitals? Well, we think the fastest way is to take a look at hotels and dormitories that are available, and then rescope them. Maybe put in the power they need. We do that very, very quickly. Some of you are talking about putting under pressure into the capability, so if there's any type of disease, it stays in, it doesn't go out. But we can quickly build capacity in this way. We did this during World War II. The Greenbrier, which sits out, if anyone's ever been to Greenbrier, was an Army hospital during World War II. So this is not something new.
Do you see the idea of using hospitals and dormitories, is that imminent? Is that something we can expect to see as a decision being made, or is that an idea that's...
Well, what we're doing is we're working with the governors. One of the things that is giving them options. We can build, we have the capability. We say build Army engineers. What they're doing is contracting. They have the capability to bring in the expertise. They're not actually, we're not putting Army engineers to build that. But what we're doing is offering those governors options. We can build, but it may take you this long to build. We can kind of scope these dormitories and hotels, or we can come up with some other options. And in a lot of these situations, like large open tents aren't really the best place to put people with infectious diseases all together. So we're working through some options and giving them some options that they can work with.
Is there an update on whether New Sanford is going to be soon at full operations again?
We've had to gradually come back after the shutdown. The CDC has revisited New Sanford 2 times, each time allowing more of the laboratory science to be allowed. Under the strict regulatory requirements of the CDC, it's come back much faster than anticipated. COVID-19 is not considered a bioselect agent, so it's not under the same restrictions. In fact, when it was known that New Sanford would be involved, first phone call went to the CDC, And they assured me, no, we absolutely need USAMRIID's help on this, like they have with other responses. This is not it doesn't fall under the same category. The same restrictions do not apply. But with respect to the other types of work, they were released, or actually allowed to conduct a second wave, if you will, of experimentation, which brings us up to about the BSL-3 type of capability. And that's continuing to be a gradual process back to full operation capability, if you will. But again, with the COVID-19 efforts, we're allowed to go full speed, if you will, with full operational capabilities.
Overseas, we've heard the case about what's going on at Fort Bliss and some other bases when they're being quarantined. Obviously, we have these social distancing measures in place, but it doesn't sound like they were being implemented fully when they're returning. So if you comment.
Yeah, first of all, we have the greatest soldiers in the world, and they're very disciplined. But we absolutely have to learn, just like the rest of the society has to learn, that we're going to have to change our habits. And what we've done in the past doesn't work for what we're going to do for this particular case. So I think the expectations were a little different from when they redeployed in the past and what they're doing now. They're doing great. The senior mission commander is going to address the issues that we had, but this is something we all have to learn how to live with. This is how we have to learn. We gotta be socially distant from each other. We're just not used to that. We're not comfortable with that. And every time we get this, we're gonna learn. And that's what's great about our Army. We talk. We're constantly communicating globally in an instant. We have the resources that we can talk all the way across the globe and say, hey, this is what I learned. That didn't go so well. We're going to improve on that, and we're going to improve every day. Our soldiers are disciplined. The leaders are great. We have ways to learn on this, on how we bring people back and how we interact with each other, and we're going to get better every day. And the soldiers are going to understand we're going to protect the force. We got to protect not only the soldiers, we got to protect the American people. So we're going to learn from this, and I think we're doing the right thing.